Mrs. Abernethy was admitted to the hospital due to pneumonia. She was started on the proper antibiotics. Her white count on admission was 18,000. Okay. Again, in these cases, what is the white count? White count basically means you look at the CBC with differential, and in this case, her neutrophils probably were elevated. Even though she's improving clinically, afebrile and oxygen need is coming down, her white count is still trending up, and on the third day, it's 35,000. With predominant left shift elevated neutrophils. That's the term we usually use in patients who have elevated neutrophils. We just say left shift. The patient feels well and wants to go home. What are your thoughts about her white count? So in this case, the patient came in with pneumonia. She has an infection. Her white count went up, which is very common in patients who have infections, of course. Her neutrophils also up. You start her on antibiotics. She's getting better clinically, but for some reason, her white count went up and goes up and up and up. And for some reason, we don't know why it keeps going up like that. What happened here? Should you keep this patient for another few days to make sure her white count is going down? She's now on room air. She's feeling better. She's afebrile, and she's ready to go home. This is what we call a leukemoid reaction. So in these cases here, the patient is actually feeling better clinically, but for some reason the bone marrow, and we don't understand this, the actual physiology of this, but for some reason this leukemoid reaction, what happens is that the normally the white count should be trending down once the patient is feeling better, but despite them clinically getting better, the white count continues to go up. Okay, in these cases, the neutrophils are mature. There are no blasts present in this case, like in the leukemia. And in these cases, don't worry, their white count is going to get high, it's going to plateau, and then it's going to start coming down. If the patient is doing better clinically, they're on room air, they're feeling better, or in any kind of infection, this leukemoid reaction can happen in anything. So in these patients, if they're feeling better, getting better clinically, you don't have to keep these patients until their white count is back to normal.